What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Man, you are one pathetic loser.
Your show was better when you had medical questions. AIDS!
It's mucous membrane, bro.
This is not how sane people act.
I don't care. I don't care.
How stupid.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
Number one thing, don't take advice from some asshole on the radio.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve.
From the world-famous Cardiff Electric Network studios in beautiful downtown Tukey City, it's Weird Medicine. First and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And back from sabbatical, we have P.A. Lydia. Hello, P.A. Lydia.
Hello.
And Stacy Tlouch. So, this is a show for people who would know. Hello, Stacy.
What?
For people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, or stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. All right, and Dr. Scott, the Walmart link apparently seems to be working.
Okay, good.
And so I'm going to start populating it with more stuff. And so we're not an Amazon affiliate anymore. We are now a Walmart affiliate. But thank you, Walmart. They're a lot less stuffy and dickwaddish about their affiliate program than Amazon is. It was just unbelievable. You're doing it. Didn't do anything different. For 15 years, somebody asked me, how can I get this book? And so I went to the website, and when you are an affiliate, if you take a link, you can tell it to do an affiliate link. Well, I don't know if I did it on purpose or if I just clicked the button by accident, but I sent it to them. They bought the book that way. And the next day, Amazon said, we can't tell where your links are coming from. where your referrals are coming from. So you are done. And they kept our money too.
What?
Well, but then they effed up and they paid us another 2 months. So we finally got our money back. So I'm not as pissed about that because they told me any money that we owe you, we're not going to pay you.
Wow. I know some dicks that work at Amazon.
Well, yeah, I know. Well, but I can't live without Amazon either.
Shout out.
Yeah, shout out to the dicks at Amazon. I can't live without it. You know?
Yeah.
I mean,
I use it
literally cannot live without it.
Yeah.
Although I'm going to say this, and Tacie and her friends were at the pool and they wanted pool noodles. And I'd had a drink or two, and I don't drink that much anymore. So, I was not fit to drive. But it was just a nice day. It was the first nice day. And, it was hard not to just have a couple of beers. But so I got on my Walmart app and I said, please, click, deliver these now. And within 30 minutes, there was somebody coming to the door with these stupid pool noodles. Yeah, now that was pretty
amazing.
Cool. That was pretty cool.
Okay.
Expensive to do that, by the way.
It was a treat.
But it was a treat, yeah. And I got one. Oh, one of them. Hey, Scott, you'll like this because you competed for her affection. One of them was called the Big Joe.
Oh, my God.
If you don't know what I'm talking about, go back and listen to episode 100, Prepare to be Disappointed, where we did a Big Joe dating game. And it was like, what kind of foundation do you have on your trailer? And stuff like,
she did not choose me.
No. Yeah, that's the hilarious thing. She chose Magic Mike, who his claim to fame on this show was that he took such a horrific shit in the person's room or house that he was working in that it flooded the basement that they had just finished refurbishing, and they had to do it all over again.
I mean, it was
she's never met him.
Oh my God.
Yeah, I just get queasy with poop jokes.
But it was, okay, well, you'll like this. They had all these champagne glasses out and wine glasses and all the shit water. Just filled them up. Yeah.
That's awful.
Yep. And then we were drinking out of those same glasses later at a party.
No, you weren't.
No, well, they cleaned them. I mean, they wiped them out.
That is a throwaway.
Wiped them out.
Throwaway.
What you got a dishwasher for?
Paper towels. Oh my God. They were fine. So anyway.
Oh, beautiful.
Yay. We have the female version of GVAC in here now. It's awesome. As far as the puking, Scott and I couldn't make GVAC. Just
dry heave.
Yeah, just dry heave.
Yeah.
Just with the littlest thing. That was so much fun. Check out Roadie.drsteve.com, ROADIE.drsteve.com for the Roadie robotic tuner. If you have a stringed instrument or someone that has a stringed instrument, you want to get them a gift. It's a very reasonably priced gift for something as cool as it is. You put it on the peg, you strum the string, and it will actually tune it for you. You don't have to ever touch the peg. So check that out, roadie.drsteve.com, or you can go to stuff.drsteve.com, see the Walmart link, or scroll down. You can see the Phoenix penis device for non-drug erectile dysfunction treatment, but also the Roadie robotic tuner. Check out Dr. Scott's website at simplyherbals.net. We're going to talk about that in a minute. And go to patreon.com/weirdmedicine. I'm just throwing all kinds of stuff in there right now. There's stuff from Normal World on there. My one-shots go there first. All the times when Scott and I play music, I cut that off and stick it on there. I don't know what the Patreon people did to deserve that, but anyway, it's fun. And then cameo.com/weirdmedicine. I'll say shout out to you, Mom, or anything else you tell me to do within reason. All right. Very good. Don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Dr. Scott, you got any updates for us on simplyherbals.net?
Nope, just lots of good nasal spray.
Yeah, he makes the best CBD nasal spray in the country.
Yeah, absolutely.
Somebody tried to use an off-brand because we call every other brand an off-brand.
Yeah,
and they didn't like it.
No.
And so they came back to Dr. Scott. So there you go.
That's the best kind of testimony.
There you go. That's right. That's right. All right, PA Lydia.
Hi.
So everyone really enjoyed your your erotic massage story from last time.
Yeah.
It was brutal.
Not so erotic for me, but yes.
No, I know.
Yeah.
Like everybody enjoyed it except
It's erotic for somebody.
everybody else enjoyed it.
No, you were basically assaulted. So that part's not.
We'll just bury that part.
There you go. We're burying the lead with that. But anyway, so you were a big hit. So thank you for coming back.
Sure.
And you're going to be here more often, I hear.
Yeah. Not as much travel, hopefully.
Yeah, that's exciting.
Going down to one job.
Okay, that's awesome. Cool. And if you could get just a little bit closer to the microphone, that would be fantastic. Thank you. We're working on PA Lydia's mic technique. No problem. Yeah. So, and Tacie, what's up with you, man?
Passing through.
Yeah, passing through. Good to see you. You came in on your bike.
Yep, came through on the newer Harley that I've got. So riding up to New York and then
from
Knoxville, Tennessee.
Oh, you were in Knoxville?
Yep. It lives in Knoxville. I work out of Louisiana, but what am I going to say Louisiana? 11 miles of a straight road and an alligator.
Right.
So I'll leave them up here in East Tennessee where the mountains are.
Okay.
Got a meeting in New York on Monday. Meet the new boss.
And you're going to ride a motorcycle all the way up there?
Well, so I don't know. I don't know if I like this bike or not.
Okay.
It's like, okay, if I were to give you a new gun or a new bass guitar or anything else, you're not just going to instantly love it.
Right.
And so I bought this bike, I threw it in the storage unit with the other bikes, and now I've got a little bit of time, so I'm going to take a few days and just enjoy it and see if I like it.
I know nobody listening to this gives a shit about any of this, but I am very curious. What's to love or what's not to love?
Open freedom. I go where I want to go.
No, on the bike.
On the bike, in the wind. I listen to what it's just independence.
No, I know, but you said you don't know if you love this bike yet.
Right.
So what's to love about it?
What's to love about a new bass guitar?
Okay, I hear it. I can answer that. You're answering my question with a question, but what's the difference between one bike and another, I guess, if they're the same, engine size?
Horsepower, the performance of it. Like I've got two, which are just about alike.
Yeah.
But this one I've got right now feels like it needs another gear in it because the engine's not as good as the other engine.
Okay.
But it's more comfortable.
Yeah.
It's got a better stereo system on it. It's got a better cruise control system. It's actually what's called a ultra limited, and it's a Shriners edition. Like you see the performance bikes of the Shriners at Christmas parades. It's one of these. It's also a police-based bike.
Okay.
But it's has add-on extras. The seat actually has airbags in it for better suspension in it.
Okay.
Things such as that. I'm trying to see if I like it.
All the shit that actually doesn't matter when it comes to a bike. All
it makes it comfortable for me.
Right.
Fluff. And then if I don't like it, I'll sell it.
Yeah.
Well, there you
go. I had a mountain bike, an off-road bike when I was 17. And there were a lot of I grew up in the mountains in North Carolina. I had 4 miles of dirt road going to my house. So we had all kinds of places I could take that bike. It wasn't roadworthy, but nobody gave a shit. I was on the highway anyway in my area because it was so rural. But I cannot imagine sitting on that thing for, what is it going to take you to get up from 12 hours? 10 hours?
10 hours.
10 hours.
I'm going to make it halfway tonight. I've got 500,000 Hilton points. I'm going to stop and get a Hilton, see what the weather looks like. And it's not a big rush.
I don't know if I could do 5 hours.
No,
I'm just not a biker.
This one you can. Like I said, it's got airbag suspensions in the seat.
Yeah.
It's got lumbar support in it. I've got cruise control. I've got 3,500 songs loaded on it, plus like 5 books on tape.
Is there? Okay. That's pretty cool, actually. Is there any association with motorcycle riding and deep venous thrombosis? Anybody know?
Ooh. I don't know. I haven't seen a motorcyclist in clinic.
I've never seen one.
I would say no, because the gas tank's not big enough to let them go far enough to have DVTs.
Oh, well, that might be something. It says here, motorcyclists may be at risk for deep venous thrombosis and edema if they ride in the same position for long periods of time.
I know if I don't ride for like 2 or 3 months because of work, and I come up, and if I go hit the Blue Ridge Parkway, my thighs, my hips, and all that will just kill me because I'm out of practice from my weight balance ratio.
Sure.
I got to throw it into the curves, and I'll ride with my thighs almost clamping around the gas tank and everything.
Yeah. So let's talk about why don't you talk about what a DVT is while I'm researching this, PA Lydia?
Yeah. So that is a clot in a larger vein. So it's the deep venous system.
Right. We don't care about clots in the
superficial clots that you can just see and that are painful sometimes.
So why do we care about a clot in a vein?
So we care about the clots in the deep veins because those clots can break loose and travel to vital structures in your lungs and cause a pulmonary embolism, which could be fatal.
That's correct. So the sort of classic presentation of this is someone has swelling in their leg, pain in their leg, and they've been on a plane, or don't have to. If they have cancer, they have increased risk of coagulation anyway.
Recent surgeries.
Yes, and then just prolonged periods of immobility. And there's every once in a while you hear about somebody on an airplane that's going from New York to Los Angeles, or one of those transatlantic or even transpacific ones where they'll have a pulmonary embolism or a deep venous thrombosis afterward. And so the thing, if it cuts loose, it's just basically a fibrous bullet that goes up the leg and then up through the thing called the superior vena cava and then into the right side of the heart. Now, the right side of the heart pumps used blood into the lungs through the pulmonary artery, because artery just doesn't mean fresh blood. It just means pumping away from the heart. And then those things can lodge in the heart. And if you get a big enough one, it can kill you within a couple minutes, because now the lungs become non-functional. They can't transmit oxygen from the outside to the inside. And that's it. These giant saddle emboli, these big giant ones. Did you see that picture of that guy that puked up
I did.
This is a completely different thing. This guy had bleeding into his lung.
Okay.
And it clotted, and he coughed up basically a mold of his bronchial tree. Oh, I thought it was bullshit.
Beautiful.
It was gorgeous. And first off, how did that just not break into pieces when he coughed it up? And how did he cough that up? I mean, can you imagine?
How big was? I mean, about big was
the size of his lung?
The entire
fibrin.
Oh, I thought you meant just a little part of his bronchial tree.
Yeah,
you're talking the whole thing.
Yeah, the whole thing. When somebody sent it to me, I said, "That's got to be bullshit. It's got to be bullshit." And then I looked it up. It was from like JAMA, the Journal of the American Medical Association, or New England Journal of Medicine or something.
Yeah.
That's crazy.
They've got a great.
I didn't think that was possible.
Got a great quick question. Don is asking, how do you treat superficial clots?
Yeah. Well, go ahead. Go ahead, PA lady.
Sure.
You're
the
clot expert.
The clot master.
Yes, clot master.
Erotically said that.
We call her clot.
Well, first you lay down and they slide down your.
There's little Clotina stars, don't you know? She's a good.
So the body will typically self-resolve them, but they can be painful. They can sometimes cause a lot of inflammation, so redness and swelling and pain. So the mainstay of treatment is warm compresses.
Correct.
There is some evidence that you could do like a low-dose aspirin. You could have NSAIDs, but that won't really treat the clot itself. It will just self-resolve over time. So warm compresses is the mainstay.
Okay. What about like a gentle kind of lymphatic drainage massage kind of thing? Okay. I mean, I don't know.
Yeah, if they're small.
Yeah, for superficial.
It might make it feel better.
Yeah. A DVD, no.
Now, some of the superficial clots are problematic. Mm-hmm. So sometimes you do have to do a short course of anticoagulation if they're not resolving. And they can also be representative of an underlying condition. Right. So that's called superficial or wandering thrombophlebitis, where you have one superficial clot in one place, then another one pops up in another. That's usually indicative of some underlying process like cancer.
How does that relate to like varicose veins?
So varicose veins are tortuous. Meaning they're not straight. Turny. Yeah, twisty and turny just because of gravity and lack of musculature support around the vein. And so you can get pooling of blood in those. which can sometimes thrombose.
I've never seen a varicose vein thrombose though, but
I think they're big enough that
the veins in the leg particularly have valves in them.
Right.
And when you constrict your muscles, blood flows up, but it can't flow backward. For the electronics people up there, it's like a diode.
It's a check valve.
Flow can only, or that, or like on a lock.
Right.
The boats go. Yeah. So the blood is always going in one direction, but over time, because gravity is trying to oppose that flow, you have tension on the wall.
Right.
Because you've got pressure going up and pressure coming down, and the pressure going up wins, but that puts a lot of tension on the wall. And if that wall starts to expand, once it expands to the point where the valve no longer is competent, then the blood will rush down into the leg and blow that vein out, and that's what causes a varicose vein.
And they get a double load on the vessel.
That's right.
And then a triple.
Now you're just hoping that forward pressure will pump that blood up, and that's really inefficient. So those veins will get big.
And that's when you see people wearing support hoses and stuff.
Compression to help restore that normal pressure.
Get some tone back up.
And if you notice, if you're on your feet all day, you work at 7-Eleven, or you're in a factory, or sometimes us, we're on our feet all day sometimes. If you can buy these things, and a lot of pharmacies will have them, but if a pharmacy has a durable medical equipment associated with it, or you can just go online to Amazon, get the medium strength support hose. You don't have to get the TED hose, right? Those white ones those are therapeutic for people who already have a problem, or they're really trying to prevent a serious problem in people who are immobile.
Right.
But if those medium strength support hose will apply external compression, when you do that, that helps to oppose that outward tension on the veins, and it may decrease your risk of having varicose veins.
In my world, we refer to that as hydrostatic head pressure.
Well, there you go. It's what it is. Correct. It is the same thing. And I've been getting shit from Andy Hines from A. Hines Media, who's been posting our shorts on TikTok and stuff, that I'm not changing the camera enough. So what we need is a producer in here. I got to stop, doing all of this by myself. It looks like Rick, right. I'm like the great and wonderful Oz. Yeah. Exactly. Pay no attention to that man behind the monitor. Now,
that's literal right now, isn't it?
So when my motorcycle, right, it is. Yeah, you can't see me. When motorcyclists ride in the same position for long periods of time, they are going to be at risk for deep venous thrombosis. If you can't straighten your legs or move your hips, riding in that position for hours on end, and then wearing snug fitting drawers, riding pants, increases the risk as well. So what they just recommend is that every couple of hours you get up and stretch your legs, walk around, and then get back on your bike and go.
I actually have highway pegs so I can stretch my legs out.
There you go.
Let the wind blow up my pants, legs, and everything else.
Does that help?
Yes.
Get rid of the sweat.
Yep.
Let the wind blow up my pants.
Let hair things out naturally. It's a good.
What if a bug just flies up there?
Oh, I've actually got steel guards over my grips and stuff because I've hit a June bug at 80 miles an hour.
Yeah.
It comes up over the pharynx and busts you right in the knuckles. Yeah, I put steel guards.
People don't know what a June bug is. It's a flying beetle, and they suck.
And they're hard.
Yes.
Fucking hard.
They have a chitinous exterior,
exoskeleton.
Which is weird that chitin is the thing that gives beetles their hard shell and other insects, and shrimp and lobsters and stuff like that. It also gives structure to mushrooms. And one of the things that happens with mushrooms is there's so much chitin in there because mushrooms are about 90% water. So to have that structure, they need a protein in there that's going to really, be light, but hold them up. And when you have something like a lion's mane, for example, and you just eat the mushroom or you grind it up into powder, the chitin can prevent the beneficial molecules from being absorbed.
Okay.
So whenever, just a fun fact for everybody or a tip from your old pal, Dr. Steve, always, if you're going to take mushroom therapeutically, make sure it's extracted. It's got to be mushroom extract. And from fruiting bodies is best. A lot of the cordyceps that are out there in pills are actually grown in a fermentation. They're just growing the mycelium and the individual hyphae of the cordyceps, and they're not actually planting them on rice, fortified rice, and letting them grow. So I'm not sure that's as good, to be honest with you. But they say it still has as much cordycepin as the fruiting bodies do. I don't know. I sort of like having the fruiting bodies. But anyway, that's just a little life hack. I hate that term, life hack. They're not hacks. You're taking supplements. It's not a hack.
Look, can I play off of this for a second?
Yes.
Because you said lion's mane. I've been looking at that for my memory and everything.
Yeah.
So memory is something that I have been scary worried about.
Sure.
At 62 and diabetic and everything else.
Yep.
And the only way, how's the best way to associate memory? Because the only way I can think about it is like a computer.
Yeah.
To where you have your random access memory, so much RAM for quick memory, and then you have your hard drive.
Right.
For some reason, I can remember riding a bicycle, my first time on a Harley.
Yeah.
And everything else. I actually have, for some reason, to show how whenever I'm tuning my ham radio up, I have some memory of being down at Corpus Christi every time, and it's just a flash.
It's association.
But 15 minutes from now, I'm not going to remember what we talked about.
Right. Oh, I never remember what I talk about on the show. That's why I have to have Scott write it down. For real.
Right.
But that's, Ron Bennington said he had the same thing because you're in the moment.
Right.
If you're doing it right, you're in the moment, then you don't remember a lot of the things that you said. But no one knows how consciousness works. How can what's the average weight of a brain? Somebody look that up.
5 pounds.
Okay, so thank you. All right, I'll give you a bell for that. I don't even know it's true.
Give
but
myself a bell.
It is. I looked it up.
So in this 3 to 5 pound thing, depending on the person, how can it store something like a Rachmaninoff third piano concerto? And that kid, Yuchan Lim, which by the way, just Google or go, search for him on YouTube if you want to see a true prodigy. He blew the Van Cliburn away. People were shitting themselves. This kid was so good. He was 18.
Wow.
But inside his brain is all 12 Liszt etudes, which are considered the most difficult pieces of music ever written for the piano.
Okay.
Rachmaninoff's third, all this Beethoven, Mozart, Chopin stuff, it's all in there. It doesn't get mixed up. In the middle of Rachmaninoff's third piano concerto, he doesn't start playing, a Chopin etude, for example. How the fuck does that work? Where is that in there?
That's bizarre, isn't it?
And where is that place in there where I can remember walking down the stairs in my parents' house when I was 3, and my brother had a haunted house down there for Halloween. And I remember seeing a guy dressed up as a ghost, but what it really was, they were so cheap. It was a guy who had taken a laundry, one of those big, long, clear laundry bag things. Whatever it's called, that you get at the from the laundromat or the dry cleaning bag.
Ah, okay.
And he just put one of those over his head and was walking around. You could see him through it, but it was dark down there. It was scary. But I was 3 years old.
How funny!
I remember shitting in my crib. And wondering why my mom was mad because I thought I was doing something really cool. And I was nonverbal at the time.
Right.
I don't believe it for a second.
So the whole memory is nonverbal. It was visual, but I understand why chimps. We were at Busch Gardens one time, and we were watching the chimps, and one of them shit into his hand, and then the other ones came up and it's like, "What do you got? What do you got?" And they're all poking at it and stuff. And look
what I made.
I made it right, and that's how I felt.
Yeah.
Funny.
I remember when
it's my first gift I ever created.
Yes, and I shit, and it made sort of a nice spiral sort of design in the crib, and I couldn't understand why my mom was so pissed. I thought she would think it was cool. Now that's my adult mind, but that was the sort of emotion that I had at the time.
But how does that store in this? And it's a liquid chemical thing that's mostly just fat.
Nobody understands.
I've always thought it was a lot like a wormhole, kind of, when you start going down.
Right.
And you kind of, all these memories, they start to kind of add up and they pull in and take you down to where you.
Right.
And that's how they don't mess up those songs.
Sure. Some of it's fragments, too, and the brain will recreate the image from the fragments. That's why people who hear static in their ears, for example, will sometimes their brain will interpret it as music.
Well, speaking of,
go ahead.
I'm sorry, Lydia.
Reading about this, guys. So, and now I lost it, but there was a study done trying to figure out where old memories are stored in the brain. So they took 12 men and they did functional MRI. So they were doing MRIs of the brain while they were asking them to recall.
And they're in real time. They're in real time, and they can give them an injection that will light up in places in the brain where it's being used. So go ahead.
Yeah. So I was just trying to think. It seems that most old memories over 12 years old were stored in the frontal cortex.
Really?
And then
that's weird because to me it feels like it's coming from the back of my head.
Yeah, and then the activity in the hippocampus and the amygdala reduced when recalling old memories.
Is that right?
Which is interesting because when we think about the amygdala activation or opening, it's usually associated with heightened awareness and heightened anxiety, probably for the moment. So that might make sense why that would be a more short term.
You would have to turn that off to see something from the past.
Well, and I was going to say the reason it makes sense if you think it's coming from the back of your head is your visual cortex is in the back.
Yeah.
So you might, just all that stuff is stored in the back part of your brain. You can kind of see it.
Is that why you look up and to the left when you're trying to recall a memory?
No.
Okay.
And looking up.
Do you know the answer to that?
Yeah. Well, looking up and to the left and looking up to the right, different sides of your brain.
Yes.
As far as the mathematical side or the artistic side. And you can actually ask people questions. If it's a mathematical question, you can watch and their eyes will roll up to one side, where if you ask them to sing a song and they have to think of it, it'll roll to the other side.
Really?
Yeah. Because I remember that from law enforcement. I'm going to tell you, I'm going to know if you're lying to me or you're trying to create something.
Right.
Well, that's interesting.
Or you're going to tell me for the most part, what the factual acts are.
And if they look up, then you know that they're,
and then which way, if you're looking left or right, are you trying to think of something or are you trying to remember something?
Wow. That's interesting. I'd like to see a study on that to see how accurate that is.
I'll bring a test. I've actually done that test before, but actually a little test we can do, and we can watch your eyes. We'll just ask you the questions.
Okay.
Be like,
oh, that'd be fun. Yeah, let's do that.
That'd be easy. Yeah.
Because ever since I had my little brain event, years ago, that's just been fascinating because,
Yeah. There was a book about a guy who couldn't forget anything. Have you ever heard of this guy? It was The Mind of a Mnemonist. And it's a great book. It's also written by the same guy, I believe, that wrote The Man Who Mistook His Wife for a Hat. Right.
Yeah, Oliver Sacks.
Yeah. So he wrote this.
What the fuck?
I remember things too.
I think it was Oliver Sacks that wrote The Mind of a Mnemonist. I'm going to have to look it up now. But the thing about this guy was he could not forget anything. And they would give him lists of 100 objects, and he would recite them back. And then they would come back years later and say what was on that list. And he was able to recall those. Now, one time he missed one. And I'm sorry, The Mind of a Mnemonist is a different guy. It's Jerome Bruner wrote that. But they're in the same sort of category. So my brain lumped them together. There you go. See that association. But he forgot something, and it was a candy cane. And they said, why did you forget the candy cane? And he said, oh, yeah, I was walking past the brick wall and I had leaned the candy cane up against it. And when I walked past it, it blended into the wall and I didn't see it.
So remember where you left it at and everything else.
Yeah, well, he had to go back. Right. He had to go back and then he found it in his memory bank. Isn't that crazy?
Yeah.
I have been wondering, is some of this related to, type 2 diabetes and sugar level?
Well, so if you're having uncontrolled blood sugar, Dr. Stevie can correct me, but you would be more likely to have microvascular complications.
You would think, or atrophy. Atrophy.
Explain what that is.
Good, because I'm lost this last year's Easter egg.
Now, we just threw out some jargon. So microvascular disease, just a small, tiny blood vessels in the brain that can become affected by high blood pressure. Or
just like your
blood sugars.
Just like your feet, if you with neuropathies and things of that nature. Or your eyes,
Type 2 diabetes increases your risk for strokes and heart disease. It also increases your risk of dementia. But what kind of dementia is the question that I'm having. So they did a newly published study examine this association between the age of onset of diabetes and the development of dementia. And they did a large ongoing cohort study. There was 10,000 people aged 33 to 55, and 33% were women in London. And data on diabetes, including fasting glucose, was obtained at ages 55, 60, 65, and 70. And dementia due to any cause was the primary outcome measure. So it could be microvascular, could be multi-infarct dementia, could be frontotemporal dementia or Alzheimer's disease. And they looked at age, sex, race, smoking, alcohol, and other things like that. And what they found was there were 1,710 cases of diabetes and 639 cases of dementia. And for every 1,000 people, the rates of dementia were 8.9 in those without diabetes at age 70. And if they had diabetes, it was 10.0. And then 13.0 for 6 to 10 years of diabetes and 18.3 for more than 10 years. So it did increase their risk, but I'm going to bet they didn't really talk in here whether it was multi-infarct dementia, but the diabetes
close enough.
You said multi. The multi-infarct dementia is from little mini strokes, and it's just ticking off parts of your brain. Now, people with Alzheimer's will tend to march through the stages of dementia. There's 7 stages of dementia, with 6 and 7 having multiple substages. And most people will start at stage 1 and work their way down to stage 7. And nice and easy, and it's kind of an inexorable decline, but it's a decline. And it's a smooth curve for the most part. People with multi-infarct dementia will have a stepwise decrease. They'll be okay, and all of a sudden they've got a little memory loss, and then all of a sudden they're eccentric, and then all of a sudden they get lost outside, and it happens suddenly. They'll go for long periods being okay, and then boom, they'll have a decline. And when you do an MRI on them, you just see lots of little infarcts in there. Little infarct just means, tissue that died because it didn't get blood supply.
Okay.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
This episode is brought to you by CarMax. Searching for your next car? Don't settle. Thrive. At CarMax, it's easy to shop online or in person. With upfront pricing and tools designed to help, finding a car you love has never been easier. Plus, you can sell or trade in your current vehicle with an online offer in minutes. No strings attached. Start shopping now to find a car you'll love at CarMax.com. CarMax, the way it should be.
Bring fun to life with the Instax Mini Link 3 smartphone printer. It's easy to transform your everyday moments into colorful Instax mini prints straight from your smartphone's camera roll. And with the new Click to Collage feature, you can create the ultimate in-app photo booth experience. Instax Mini Link 3. Don't just take, give. Click or tap now to learn more and shop.
All right.
Because this resting glucose thing is just weird.
Well, yeah. So you can cure type 2 diabetes often with lifestyle, but not always.
Because I've started wearing the glucose monitoring.
Yeah.
And I hate this thing just because I don't want to be tracked by everything. And that's what I feel like.
Here we go.
I'm an independent redneck hillbilly.
Is it one that is continuously reading a report out, or do you have to swipe your phone out?
I have to swipe my phone to it.
Okay. When you
He's
do that,
worried about
can you get a real...
Exactly.
the government somehow
monitoring his blood sugars.
I worry about my insurance.
They don't give a shit about your
They do monitor whether you wear a CPAP at night and your insurance stops paying for it if you're not.
That is true. That is true.
So there would be, it's a valid concern, not a realistic one, but
Well, yeah, and if you are diabetic, the biggest
you're right.
Your providers get reimbursed more if you're diabetic than if you're not diabetic.
Because I'm getting ready to go see the endocrinologist first time in years.
Depends on their payment, Scott. That's not always true.
Okay, yeah.
But I'm going to go see an endocrinologist in August. I finally agreed to go do that.
Okay.
Because I'm scared to death that it's related to memory and everything else. Just trying to get a grip on it.
Well, and neuropathy.
Right.
And,
visual loss.
Visual is starting to...
Yes, it fucks up everything.
Everything, yeah.
You look like you've lost weight, though. Have you been losing weight?
I have.
That's good. That will help.
I had to quit doing one of the jabby weight loss things because I couldn't get it. Then when it became available, I did it. We're not going to...
Semaglutide, you mean? Whatever. Go on.
I had upper respiratory at the same time, so I didn't know which one it was. But when I went back on it, every night when I start coughing, I start throwing up.
Oh,
for about a week until this stuff got out of my system. So I've quit doing that. But
there is one tirzepatide, which in the clinical trials did not have the GI side effects that semaglutide had.
That's the one that's almost impossible to get, though. It's listed for diabetes. It's Mounjaro.
Right. So what I've done is said, pretty much screw the system. I started eating a salad at night with chicken salad on top of it, or something like that, or salmon, or instead of McDonald's and everything else. So I've started losing weight there.
Let me tell you what I had to do. I was at 200 pounds at one point. I got down to 160, and then I maintained that for a long time.
Mm-hmm.
I went to the beach one year, and I just ate and drank whatever I wanted to. And when I came back, I was 174. Yes, I gained 14 pounds. I was there for 14 days, so I gained a pound a day. And I'm like, that's no big deal. I'll just I never could get rid of it again. And then I got up to like 186. I said, oh, shit, something's going on, because my dad was obese and my brother is not. And I'm not a big guy, but I was carrying a lot of more weight than I should. So when I got to 186, I went to this online sort of program that they've got two of them, and they're kind of like reflect your gender. If you all can figure it out, I'm not going to say the name of them, but they got one for men and one for women. And they put me on, because my problem is I can go all day without eating. I can eat a salad for lunch if I do eat anything. As soon as I get home, all the carbs start going into my mouth. I cannot stop. I can't stop. So what they did was they put me on naltrexone, which is an opioid blocker. And what they're trying to do is decrease the pleasure syndrome, or the pleasure center in my brain. And so, because they use it for alcoholism, and you can use it for opioid addiction as well. And it's kind of interesting. I'm still ramping up, so I haven't noticed a huge effect yet. But starting Monday, I doubled the dose in the evening, and we'll see.
Because I was 280 for years. And then,
Lord.
Yeah. Then started doing the, stabby in the stomach and everything. I got down to 235.
Yeah. What do you weigh now?
240.
Oh, okay.
And I've not done stabby in probably 4 or 5 months.
Now, you're tall, though.
Yeah.
You're
6'3".
6'3". I would have guessed 6'3". I'd be good at the carnival if I get fired from my job.
The issue with this continuous glucose is I take Scott's advice. I don't eat or drink anything 4 hours before bed.
Yeah.
It's mostly a salad and, some type of protein in there with it.
Mm-hmm.
And I don't very rarely do alcohol. My big thing now is just ice water, and I'm happy with that.
Yeah.
And then I go to bed, and we'll get up, 4 times in the middle of the night to take a piss.
Yeah.
But usually about 3 or 4 in the morning, I'm going to check my glucose. I check when I go to bed. It's like on the phone, it's like 120 to 150. No, I won't. Not till I get a bell. And how many years I've been here? I got one bell. But I'll check it like at 3 in the morning, and it'll be 350.
Oh, at 3 in the morning?
Yeah. How the hell does it double while I'm asleep?
I have a question for you.
Yeah, we know.
Never mind. Keep playing sound effects. Never mind the medical stuff.
No. Okay, so Tacie asked, and he finally got to a good question, which is, in the middle of the night, he checks his blood sugar, and it's crazy elevated. Now, we know why, and PA Lydia is going to answer this question because she wants a bell.
Well, there are 2 possible reasons. So number 1 would be the somogyi effect.
Give thyself a bell.
Which is actually a bit rare, and I'm not convinced you have it. So the somogyi effect is in response to a hypoglycemic event.
In other words, if your blood sugar goes down because of whatever you're doing to treat it, and then in the middle of the night you get rebound high blood sugar.
Yeah.
It bounces back, and it bounces back higher than.
So the question would be whether your monitor is tracking that you've had a low event, if you can see that.
Do you keep it on all the time?
Yeah.
You do keep it on all the time. Okay. Even though you're worried that the government is tracking your blood sugar.
I can't turn off my iPhone. I'm always on call.
Yeah.
So if you notice that you're having a low event before it's going high, then one of the things we were taught in school to recommend was to have a little bit more of a carby snack before bed. So like a handful of blueberries or
key lime pie?
Yogurt. No.
See?
A carb.
Give him an inch.
A carb with fat. Right. So it's a slower burn. If you combine fat with carbohydrates, you burn them a little bit more slowly.
Yeah.
So
an almond joy.
Peanut butter.
I do almond
a good scoop of peanut butter.
Yeah.
Love peanut butter.
Yeah, that would do.
Yeah. So the other possibility, which is much more common, is called the dawn phenomenon, where you have an increase in your hepatic gluconeogenesis. So your liver starts releasing more sugar into the bloodstream during that time, and your tissues are a bit less sensitive to insulin. And if you are not producing as much insulin because of your any pancreatic dysfunction, then you will be more likely to have an elevation in sugars in the morning.
Yeah. But, normally I think of that as like 6 in the morning, but he's got a weird schedule.
Yeah,
so it could be.
Can I help with that?
Yeah.
That's 3 a.m. is considered the liver time in Chinese medicine. That's when the liver is the most active. It is. It is. So what you'll see is people wake up at 3 a.m. because their body is stressed, and they sometimes it is associated with hyperglycemias and higher cortisol levels, et cetera, et cetera, et cetera. But that's a liver time in Chinese medicine.
Well, that's sure. Isn't that interesting? Because glucose, meaning sugar, neogenesis, meaning new making of. In other words, it's making sugar from the starch that's stored in the liver called glycogen. That it does happen at that same time. So that is kind of interesting that they figured that out.
Yeah, it's funny. And then in the first thing in the morning is the large intestine, time for the colon, which we always tell people if you're trying to have a regular bowel movements, take your magnesiums and stuff at bedtime. And then hopefully first thing in the morning you get up, get moving and have your normal constitutional first thing in the morning because it's the liver, or that's large intestine.
And the other thing we probably should be talking about is the hormonal changes in the morning as well. And that probably prompts the dawn phenomenon to some, which is cortisol. And that's why a lot of heart attacks happen at 6 a.m. as well. Cortisol is a stress hormone. Apparently the brain is preparing the body to wake up and get ready to go, and it starts secreting this.
And doesn't testosterone spike also in the morning?
I don't know if that's true. I'm not saying it isn't. I just don't know if
That's why I
that's.
wake up.
Well, yeah, exactly.
Yeah.
No, I'll wake up
in the morning. I don't think that's it. But you can
I'm
look
just kidding.
I'll look real quick.
Yeah.
That's called a kickstand.
Okay. Now we have a bunch of questions. Why don't we get to some of them here?
Number one thing, don't take advice from some asshole on the radio.
As fascinating as this is. Okay, I like this one. Let's do this one real quick. Oh, if we can get to it. Okay, there we go. Hello.
I have a question about
Lion's mane, cordyceps.
My girlfriend is scheduled to have a tummy tuck.
Excellent.
Like the second week of August, I think.
We endorse that.
And she did mushrooms
Okay, he's talking about a different kind of
mushroom. Ago, 2 months for her surgery, and she's concerned that the mushrooms will somehow affect the anesthesia or may cause a problem with her surgery. So she's a little bit paranoid about it, and she's wondering if she has to delay her surgery or if it's not won't affect it. And she's also wondering, what is the amount of time you should not do mushrooms between doing the mushrooms and a surgery like that. Can't find any good answers online, really, because every time you ask a question, doctors just respond with, you
shouldn't be doing it. Right.
To condone it.
Correct.
Enjoy the show. Love you guys.
Hey, thanks, man. And good luck with the surgery. So the elimination half-life for psilocybin is about 2 hours. So if you take a dose of psilocybin and it is converted to psilocin, and then it starts to degrade in the system. So 2 hours, you've got half left. 2 hours more, you're going to have 25% left. Another, by 6 hours, it's 12.5, et cetera, et cetera. So 2 months out, you're going to be fine. She's paranoid because she used up all the serotonin in her brain doing the psilocybin, and that's one of the side effects. You wake up the next day with regret or paranoia or anxiety and stuff like that. So you got anything to add to that, PA Lydia?
No, so then the issue is that she wants to do it again between now and the surgery. We would say at least wait, 3 to 5 days?
Yeah. Well, we can't say even that. Just, I would go into surgery as straight edge as I possibly can.
Absolutely.
I have no evidence that psilocybin is a problem with anesthesia, but you know what? Thanks to Timothy Leary, popularizing psilocybin in the day, and the government saying, F you, we're not going to fund any more research for the next 40 years. We don't know.
Yeah.
We don't have enough research on this stuff to tell us. So it's an unknown. So I wouldn't mess with it. I don't think it would be a problem, but I would just go in straight edge as you can.
Absolutely.
And then, anyway. All right. Okay. Just to be safe. We want those boobs to be luscious and perfect and not to have any problems, right? Okay, here we go.
Hey, Dr. Steve. About 3 or 4 weeks ago, I started just smelling smoke all the time. It would be in different rooms, in different environments, outside, didn't matter what. I'd occasionally just smell smoke. Not all the time, but a lot of the time. And sometimes it just comes out of nowhere. Also, hold on a second.
Okay.
Sorry.
No problem, man.
I did have COVID about, 4 months ago.
Yeah.
And I did lose a lot of sense of smell, but it came back. It was fine. Suddenly, I just smell smoke all the time. And it was really weird because this girl I occasionally bang used a strawberry vape. and it smells like cigarette smoke to me. What's going on? Do I have a tumor? Am I dying? Let me know.
Yeah. So anybody know the name of this?
Hypnagogic hallucination.
No.
That can be smell.
Yeah, no.
Miss nausea.
Hypnagogic is during the induction of sleep, though.
Instead of anomia, it's misnomia.
No, it's phantosmia.
Oh man, I deserve at least
Phantom
for making up a new
ghost
word.
and osmia meaning smell. Yeah. So they don't know what it is, but it is weird that he lost his sense of smell with COVID. Yeah. And then after it came back, now it's distorted. So there may be some inflammation in there, which may mean that it's possible that he could reverse this. Mm-hmm. They mostly don't know. It's tons of conditions: traumatic head injury, upper respiratory tract infections, aging, and then some of the more, sinus infection, and some medications even can do it. But, low thyroid has been associated with it, but also temporal lobe seizures, which I don't think he has. I think we would know if he had temporal lobe seizures. So those are really interesting seizures, by the way, where people all of a sudden will think that they're in ancient Rome and stuff like that. I'm looking at a study from, from the National Library of Medicine. It just says most often it's idiopathic, which means the doctor is an idiot and the patient is pathetic. No, it means that we don't know what caused it, right? And so it's either peripheral or central. And that is difficult for us to determine whether it's in the nose or in the brain. But an ear, nose, and throat doctor may be able to figure that out.
There was a study that about 6% of patients polled who had COVID-19 had developed phantosmia.
Is that right? Does it say the timeline?
Let's see.
That's okay.
Now I'm in a larger study. It just cited
That's okay. Yeah. I gotcha. That's very interesting. So I think the two may be related. And if you went to an ear, nose, and throat physician, they may put you on a nasal steroid just to see if it calms things down. I do know that there were a couple of pieces of data out there that suggested that if you get COVID and you spray your nose with a nasal steroid, which you can buy over the counter, while you had COVID, you're less likely to lose your sense of smell. I will say, and this is anecdotal, this is just me, that I took that advice both times that I had COVID, and I never even lost my sense of smell or taste to any degree that I'm aware of. So, all right. See an ear, nose, and throat doctor and let us know what they say. Okay, I'm very interested to hear what they say. All right. Let's do this one. This is a good one. Hey. Hey, man.
Question quantity. Doing well first, I guess. But
what's he talking about?
The question is, I've been on testosterone replacement therapy for about a year and a half, and I was just wondering, how long will the testicles continue to atrophy? So a year and a half in, it's definitely happening. They're way smaller than what they were. I feel like, is there a headroom there? Does it just stop at some point?
Yes.
Or do they atrophy to essentially nothing? So I guess I will wait and listen closely for a response. Appreciate it. Thanks.
Yeah. Testosterone definitely tells the testicle, hey, bro, we got you. You don't have to work anymore. You can rest and just take it easy. You can retire. And so when it does that, because the testicles are producing testosterone in response to a hormone from the pituitary gland. And when the pituitary senses that there's enough testosterone, it stops sending that signal. It stops placing orders for testosterone. And think of it that way, that the testicles produce a product called testosterone, and the pituitary gland is placing orders for testosterone. When it gets enough, then it says, okay, we're good for a while, don't send anymore. And so you get this undulation, then it drops again, and it starts sending the signal. And you get this undulation up and down and up and down. That's there all the time. So many of our hormones and other systems in our body work this way with this sort of tonic feedback loop. So, but if you start taking testosterone therapy, the pituitary says, hey, we're good. We don't need any more. And so the testicles stop producing and they start to shrink and atrophy. Most of those people no longer produce sperm. So I think it's I don't know how long he's been on this or how much his testicles have shrunk. They will shrink, but they shrink down to, where there's just matrix and then they stop shrinking. But if you don't want to have your testicles shrink and you might want to continue to be fertile, there's another option. It's called clomiphene. And clomiphene actually is a drug that stimulates through, sort of indirectly, but the outcome is that it stimulates the testicles to produce testosterone. So
that sounds like a better option.
Yeah, you're increasing your own testosterone production in the testicles so they don't shrink. As a matter of fact, I'm guessing they may enlarge a little bit. And if you stop taking it, or if you at any time in there, you'll still have live sperm in your system. So I got some people that, they have low T, but they want to still have some kids. Sure. So they could jerk off into a cup and save some, or they can take clomiphene and they can just, impregnate somebody the old-fashioned way, the more fun way. All right?
How does a hormone transport?
Oh, through the bloodstream.
Okay.
Yeah, it just seeps into the bloodstream, and there's receptors there waiting just for that one thing.
Right.
It's crazy. And there's jillions of them.
I said there's got to be so many things going through this.
There's so much shit going on in your body, you can't even believe it.
Right.
Just one time, go and look at YouTube and Google mRNA transcription. It's the craziest fucking thing you've ever seen.
I'm onboarding with the new company now.
Yeah.
And I'm going through that transcription and translation and just looking at everything at the DNA to protein level.
Our bodies, going back millions and millions of years, maybe even 1 billion years, figured out how to create a set of instructions that are not too dissimilar from punch cards in a computer to make things happen. Or like the Jacquard loom. That was one that they could program. One of the first programmable devices in the world was the Jacquard loom. And they had, little cards with punch things in it, and it would make patterns with the loom. So Babbage was making his differential engine from that, the first mechanical computer. Anyway, it's insane what's going on inside your body, and you don't know anything about it.
Yep.
Just how you grow your hair or your fingernails, much less all the other stuff like reproduction and everything else that's going on. All right. Well, anyway, I'm enough. Check your stupid nuts for lumps. Quit smoking. Get off your asses. Get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Lydia. Thanks, Scott. Thanks, Tacie.